This video is going to go over the anatomy of the ventilator circuits that you'll be using in our class. The first circuit that we're going to go over is the very basic circuit. It does not have any wires. It is a non-heated circuit, non-heated wire. So it's just your basic circuit, as you can see through. There's no lines, so that indicates there's no wires. You have two limbs, inspiratory, expiratory. As you can see, there's no plugs on the limbs or anything, so this just hooks directly to the ventilator. The inspiratory limb goes from the ventilator to the patient. The patient's inspiring. The expiratory limb is going from the patient to the ventilator. They are expiring. So inhalation, expiration, there are clear designations of where to hook them, and I will show you those on each ventilator. For we will be hooking up the circuits in lab, but just hooking them up. Even though there are no heated wires on this one, there is an inspiratory side. I know there's an inspiratory side because there is a temperature probe. But if this is not heated wire, why do we need a temperature probe? This is also made for home care, so that some patients will use a Passover humidifier. So we probably will not use it in the healthcare field or in the hospitals, but it is there just in case we need it. So you come up the inspiratory side. It'll come from the ventilator. The breath will travel up the inspiratory side, go to here, go to the patient, because right now my expiratory limb, my expiratory valve is closed. So if I'm blowing gas or air in here, the only way to go is into my patient. Then the air goes into the patient. When my expiratory valve opens, the patient will exhale passively. The recoil, the compliance, the elasticity of the chest, the lungs, the weight, everything is a passive exhalation. So we have positive pressure coming through this circuit. My valve is closed, the air goes into my patient's lungs, the valve opens, the air comes out, my ventilator is no longer delivering a breath. So this is the inspiratory side. This is called the patient Y. Why is it called that? It looks like a Y. It has a tail, or else it'd be a V. So this is the patient Y, or the Y of the circuit, and then it comes down for exhalation. Now in the hospitals, we do not use this with active humidification. We'll be using this with an HME. It will go right there. Remember, if you have to give an MDI or a treatment with an HME, what do you need to do? You need to remove it. We'll do that in 1 second. If you have a closed suction system, you would put your Ballard on there. And that is basically the setup. Now if I wanted to give an MDI, there are adapters that I can use and put them in line so I do not constantly have to break my circuit. That would go there, just like that. The next thing I need to do, if I'm using the circuit, is to remove my HME. Yes, some HMEs have aerosol or a bypass and an HME. Many hospitals do not use ones like this, so we want to get you in the habit of taking them out. The other disadvantage is that using HMEs like this, that bypass the HME process, many therapists forget to turn it back on to HME. So the patient is just lying there breathing dry air. Okay, so this is the Ballard. It's set up. I finished my MDI treatment. Put that back on, boom, there we go, all set. Remember, with an MDI, how long do you wait between puffs? That's right, 30 seconds between puffs. So if you have to give 10 puffs to a patient, you're going to be taking about 5 minutes to do that treatment. This is textbook. Remember, each hospital does things a little bit differently. This is textbook. The other circuit is a heated wire circuit. As you can see, there is heated wire in there. This is for the Neptune As you can tell, the red and yellow. For the pigtails, red and yellow, blue and yellow. As you can tell in the pigtails, blue to blue, yellow to yellow. We have an inspiratory side. How can I tell this is inspiratory side? I have a temperature probe, temperature probe. So on this one, blue is the inspiratory side. Now I don't want to hear, well, which side's inspiratory? The blue side. No, you look for the temperature probe. That's how you can absolutely tell. There are no temperature probes on the exhalation side. We have the temperature probe so we do not burn our patient's airway. Now if we come down the inspiratory side, come up to the patient Y. There is no MDI port. But if we had to do a Ballard, it would go like that. So since there is no MDI port, we need to put one in line, which will go right there. And we can just puff away. Ballard, don't have to remove anything. This is a heated wire circuit, but it came with this extra piece. If you remember, this piece is designed to go from the ventilator to the heater chamber. It will then go down the inspiratory limb that will go from the heater chamber to the patient. It will go into the patient, then the breath will come back out the expiratory limb and go out. As a reminder, my expiratory valve is closed. The breath will go down my inspiratory limb into my patient. The breath stops. Valve opens. The breath comes out of the patient. Another circuit that we have is this circuit, which is called the VAWA. Basically, it's another heated wire circuit. Remember, inspiratory side, temperature probe. This one has an MDI port built into it. Some places use it, some places don't. Go with your hospital's process. How do I know that this is for the 850? Remember, our connection sides, our wire connections are different. So this one will not hook up to the Neptune, and the Neptune will not hook up to the 850. What is the purpose of the wires inside the circuit? That is to assist in keeping the gas warm so all the humidity does not rain out. We want to deliver the patient 37-degree centigrade heat, heated air, heated breath with 100% relative humidity. And my tube fell, but it also has a third piece to go from the ventilator to the heater chamber. The last circuit that we're going over is an LTV circuit. These are a little different. They do come in a heated wire and non-heated wire. There is an LTV setup video that is on our channel. So watch that on how to set this up exactly. Now this one does not have heated wires, but there is an inspiratory limb and expiratory limb. The LTV has what we call an expiratory valve, an external expiratory valve. It is a little mushroom valve that when the patient needs to inhale, pressure comes in here, inflates this little mushroom valve, and prevents the patient from exhaling, such as the other ventilators all have it internally. We have the inspiratory limb here, comes down. If we wanted an HME, again, just like the other setups, our HME would go there, then our Ballard would go on the end. If we wanted to do a breathing treatment, it would go on to the inspiratory limb here. I know that's my inspiratory limb because this side has the mushroom valve. And that is the LTV ventilator circuit. Those are the circuits that we'll be using. There are slight variations on different circuits, but they all work on the same basic concept. You have an inspiratory limb, an expiratory limb, and how do you tell the inspiratory limb? Temperature probe. The LTV does not have temperature probes, so how can you tell it? It's the one without the expiratory valve. And remember, always take your HME out of line to do treatments, to do MDIs, and there's another video that covers MDIs and nebulizers.